Nutrition, I mean, not only to help with the whole menstrual cycle and, housing the fetus and all of that is really important. Ferritin has to be optimized. Iodine status has to be optimized prior to pregnancy. And then in particular with regard to thyroid, a lot of times people don't even think about checking their thyroid in the year or so prior to trying for conception, especially if they have a family history. And a lot of these women, they don't see the primary doctor. They're 20 years old, 30 years old. They're otherwise pretty healthy. But if there's a big family history of thyroid disease, that is something to start thinking about. If your mom or your grandmother has thyroid issues and you haven't been diagnosed, and you're planning for a pregnancy in the next year, maybe think about at least getting a TSH, if not a full thyroid panel prior to trying. And there are really important reasons for that. That has to be perfect going into a trial for pregnancy because number one, a lot of these patients, like we said, deal with infertility, and a lot of that is from thyroid hormone not being optimized. And there's an increased risk for miscarriage if the TSH is not optimized.